Rick Lee didn't follow a traditional path, and that's probably why you should be curious to see what he has to say. From around the world trek, where he found himself hitchhiking across New Zealand and selling his personal effects in New Delhi, to building 9 companies in healthcare services, Rick's story is a masterclass in risk, innovation, and resilience. In this episode, he shares how early exposure to psychiatric system abuse sparked a lifelong mission to fix what's broken in healthcare. We'll talk about his current company, Healthragious, and the myth of healthcare insurance, why reinvention means getting uncomfortable both personally and professionally. Rick doesn't hold back on topics like AI and government regulation and the investor realities that founders need to face. This one's blunt and it's brilliant, and it's packed with wisdom from a life that's fully lived. Welcome to Legacy Unscripted, sponsored by Progeny Coaching. This is the podcast where sports and business collide. I'm your host, Russ Katzman, and here we'll skip the fluff and get straight to the hustle. From athletes turned entrepreneurs to impact-driven business leaders, we dive into the wins, the lessons, and some of those failures that make our legacies worth living. Today, I'm happy to welcome Rick Lee, CEO and founder of Healthragious. Rick, thanks for joining me.
Thank you, Russ.
Now, we talked about this during our little introductory call, but you once toured the world. Tell us about why you took that trip and what was the best part of it.
I took the trip in the fall of 1972. I was draft number 14, likely to be called up and sent off to Vietnam. Mm-hmm. And through a quirk of Nixon's Department of Defense Secretary, Melvin Laird, I got a pass and I was out of the draft altogether. There was no draft. And thus I was staring at the last quarter of my college career with no plans to go to law school, business school. It's too late to apply. I just more or less caved to the reality that I was going to Vietnam. So with that in mind, I said, well, what should I do? And given that those weren't really high on my career choice anyway, I thought I should travel and take advantage of the fact that I had nobody who owned me and I didn't own anybody or owe anybody anything. So I spent the summer working 2 jobs in New London, Connecticut, and then I amassed enough money to buy a round-trip ticket on Pan Am. At that time, I think it was around $650 to go around the world, as long as you kept going in the same direction. And I set off in the end of October, leaving my parents' home in Pennsylvania, headed west. And then I went to San Francisco, stayed with my brother, flew to Hawaii, visited my aunt, then went off to Fiji and Tokyo and landed in New Zealand, in Auckland, for the first meaningful stop as opposed to bouncing around from island to island.
Sure.
And I hitchhiked out of the Auckland airport, and I got picked up by a physician who had spent his career trying to conquer the tsetse fly in Africa. He was partially blind and really stone deaf, and he was the driver. And it was like having my heart in my mouth, because he would pass cars with cars coming right at us, and he would barely get back into the lane. And so we survived that trip. I lived with he and his wife for 6 weeks, and I learned how to fish on the Ngataha River in Rotorua. And then I spent another 9 months in New Zealand, both on the North Island, South Island. I picked apples in Nelson for 3 or 4 months during the apple season. I had a singing group that we performed in the pubs in the South Island. There were 3 of us, and we were singing a cappella with 60s doo-wop songs, and it was a lot of fun. And we would practice in the apple orchards as we were picking, and then we'd go to the pubs at night and win money with our significantly improved singing talent. So a lot of fun. Went from there to Australia, was a brickies laborer, and on and on. Essentially, what I was doing was I was traveling alone, and by virtue of not having a companion, a lover, a girlfriend, etc., I had nobody to bounce off of. So I had to intermingle with the locals, the natives, and meet them. And that is an extraordinary gift, to be traveling alone and open and exposed and vulnerable, but also willing to try anything and everything. Mm-hmm. And it was that openness that really grew me from a child to an adult. I learned how to make decisions, how to do risk-reward analyses, how to be willing to take the road less traveled. And all those lessons stuck with me for the rest of my career.
Gotcha. That's amazing. So how long were you gone in total to get all the way around?
It's about 15 months. Wow. I had a misfortune where, from traveling from Nepal to New Delhi, I lost my passport and traveler's checks. Uh-oh. At that time, we had traveler's checks.
Yep.
And New Delhi's not the place to be seeking a new passport and new traveler's checks, because there's so much fraud there, or at least there was then. So I spent 7 days hunkered down in the French heroin district with a bunch of junkies and selling my clothes and my books and my backpack and things like that in order to wait out until I got my traveler's checks and passport sent to me. And that was 7 days that were pretty dicey, but ultimately I flew to Spain, where my mother was running a tennis tournament, staying at the Ritz, and I arrived grungy and disheveled with a beard, and the guys with white gloves opened the door for me to enter the Ritz, and it was a pretty contrasting view of the rich and the poor.
Oh, that's funny. So how did you progress from that kind of a wanderer life to being an entrepreneur? When did it hit you that you wanted to run your own business along the way?
I don't think I ever wanted to run my own business. I was more driven by, where can I make a difference? What can I do that hasn't been done before?
Okay.
So my first meaningful job after traveling, and I settled down in Pennsylvania for the winter when I got home from the trip, and did odd jobs. And I was in Guys and Dolls. I've been in musical theater all my adult life and had leading roles in a bunch of different musicals. So that's been an avocation of mine that I've loved and wanted to continue. But aside from that, I left Pennsylvania for the West Coast, Silicon Valley. I moved in with an aunt who had an empty bedroom, and I got a job in a psych hospital in Belmont, California, about 9 miles south of San Fran. And there at that psych hospital, I was assistant director of education. Every child in a hospital in California, if they stay for more than 2 weeks, is required to have a lesson plan and an access to an educational pursuit with a teacher involved. So I became a teacher for these patients in a psych hospital. And back in that day, psychiatric benefits were unlimited. They were 365 days of inpatient care and
wow,
just as much outpatient, because nobody used the benefits. And so what I witnessed was an exploitation of that insurance benefit by well-meaning parents. The typical teenager that ended up in our psychiatric unit was smoking a little too much dope after school. And this is in April and May. And then comes June, school's over. The two wage earner parents, one working for a Silicon Valley startup and the other in a dean at Stanford or something like that. And they're well-to-do, and their teenager is acting out, and they really don't want to have to stay home with that teenager, so they shipped him off to insurance-paid summer camp, which was in a psychiatric hospital. It was abusive. It was unfortunate. We did the best we could for these kids that were lost, and they didn't have the benefit of having parents that were invested in their future. And so we witnessed what is known as iatrogenic disease. That's a disease that you acquire in a hospital as opposed to having it be the reason why you go to the hospital.
Sure.
And iatrogenic disease in a psychiatric hospital is you learning how to commit suicide from fellow patients, inpatients. And there were a couple of suicides in my first year at that hospital and a couple more in the 3 or 4 years after that. So it was really staggering and concerning that this insurance fraud essentially was not only being abused by parents that had good insurance, but it was also leading to bad outcomes for the teenagers who were staying in our psych hospital.
Yeah. And so how did that drive you then? When did that drive you to start something on your own? What was the trigger for you?
I had a CEO of the hospital who was pretty creative, and he discovered there was funding under 92-142, Public Law 92-142, which was passed in 1973. It was essentially a special education act that required every child with special needs to be afforded public school education, regardless of whether they could do it in the public school or not. And that meant that the San Mateo County Unified School District was on the hook for teenagers who weren't really fitting in with their school environment, mostly hyperactive teenage boys. And so they would place them in our psych day school, which we created to take advantage of that law and to get additional funding into the hospital for running a day school for kids with special needs.
Gotcha.
That was very creative. It was an example of looking for funding sources.
Yep.
You have to have a payment model in order to succeed as an entrepreneur. Many entrepreneurs don't figure that out until they've failed once, twice, or 3 times. But I learned it in my first entrepreneurial experience. I created a day school for secondary students that couldn't fit in the public school.
Well, it's an interesting little dilemma that you bring up. I mean, I see this in entrepreneurs quite a bit. They try to do the chicken and egg scenario between having, fully fleshing out my idea and finding funding that will back it, right? Do I go searching for funding first to find out how much I might have available before I get excited about an idea? Or do I get excited about an idea and then say, I will find the funding to make it happen because that's really what I want to make happen?
Yeah, the business world is littered with those who have a dream, and it applies to them and them only, and they think that applies to many more than themselves, and so they create something that doesn't work for others.
Yep. So talk to me then about the evolution for you personally. How did you get to Healthragious, and what is Healthragious relative to where you started?
Healthragious is the 9th company that I've either started or co-founded. and they're all in the healthcare service world, which means we service the payers who pay for the healthcare expenditures.
Mm-hmm.
So my first entrepreneurial or first business assignment was with a firm in Wilton, Connecticut called Preferred Healthcare, and they were into managing psychiatric abuse over expenditures and abuse of expenditures.
Mm-hmm.
I had that experience in the psych hospital of seeing that up close and personal. And I took that experience and I started speaking around the country about it because I was the #2 person at the National Business Group on Health in DC. So that was a nonprofit alliance of large employers concerned about healthcare and healthcare costs. And as a speaker on behalf of the business group, I would be invited to these different conferences where I spoke on the topic of mental health and psychiatric health and psychiatric expenditures, how they were out of control. And I got recruited to one of the first firms wanting to manage that Preferred Healthcare in Connecticut. And we, in the 4 years that I was there, the reduction in expenditures for teenage psychiatric care dropped 90%. That's how inflated and abusive the industry had become. And there were 4 publicly traded psychiatric hospital chains. They were throwing them up left and right in the Southeast and Southwest because all you need are 4 walls and a nursing staff, and you've got a psych hospital. There's no equipment. It's a very profitable business. And so there were 4 different corporations with hundreds of different psych hospitals all around the country taking advantage of the unlimited benefit that employers had authorized and approved. And lo and behold, after we got started and other firms copied our business model, we reduced that abuse by 90%.
Wow, that's incredible. So today, Healthragious does what? How do you continue to support that cause today?
So we're invested in helping people get outrageously involved in their own health care. There's too much of Americans that choose to accept third-party health care if and only if it's reimbursed by a third-party payer. So a health plan or a health system, somebody's got to be paying. Otherwise, I don't need that kind of care. I don't want to pay for it myself. And it's that lack of investment and accountability in our own health that drives Healthragious to try and upset the apple cart and change that behavior across the country.
Do you see, and as of this recording, we are still set to lose the subsidized or subsidies for the Affordable Care Act, et cetera, right?
Yeah.
So health insurance costs, especially for self-funded, self-employed individuals such as ourselves, if we don't have a group health plan or don't have employees to bring in a group health plan, it's going to jump significantly. Do you see people starting to self-fund instead of going the insurance route in the near future? Do you see what's kind of going to be that tipping point to where they just say, insurance is just too expensive. I'd rather do it on my own?
Well, the whole concept of insurance is being abridged by the insurance industry. If we think about flood insurance, it's a very nominal fee that we pay every year because the likelihood that a flood is going to hit our home is 1 in 10,000 or 1 in a million.
Right.
In healthcare insurance, we treat it as healthcare. So I'm not going to buy this aspirin unless it gets reimbursed. That's
Gotcha.
healthcare insurance. What healthcare is I'm going to buy this aspirin because I need it, and it's a part of my daily living. It doesn't have to be reimbursed. My food doesn't have to be reimbursed. My trip to the laundry doesn't have to be reimbursed. Why? Because I'm getting the germs that are removed from my laundry, and those germs could create an illness for me. That's preposterous, and that's kind of the abuse that we've fomented by making healthcare the equivalent of healthcare insurance.
Yeah. Yeah, we only get those services that we know insurance is going to pay for.
Yeah, yeah. And if you need brain surgery, you can't pay out of pocket. You don't have 500,000 lying around to pay for your brain surgery, and you'll die if you don't get it. So you need insurance for that 1 in a million situation where you have a need for brain surgery.
Yeah, the interesting thing is, over the years, what we've seen is these supplemental insurances get purchased on top of health insurance to cover the catastrophic, the cancer insurance, the catastrophic one, the accident insurance, some of that kind of stuff that we get on top of the health insurance, which should be to cover that
Mm-hmm.
very same thing. So going back to that trip around the world, you you were incredibly innovative in how you made things happen. You were stuck in Delhi, no passport, no traveler's checks. You're selling the clothes off your back. You're selling your backpack. You're doing what you need to do to survive. You're innovating. Your approach to life. Really, it started way back then. How have you brought that innovation into what you've done in these 9 companies? And how will you see it going forward in what you're doing with Healthragious?
Well, I think it applies to self-awareness, that the more you're observing your surroundings, the more you're getting clues on opportunities that you could impact and improve. Uh, there's no dearth of need for
Yeah.
improving our environment, our traffic, our just I think of something as novel as e-bikes.
Mm.
So they've only been in existence for 10 years maybe, and in the last 5 years they're starting to proliferate. And what does it mean? It means that these people are on trails where they're not permitted, and they're running down walkers and joggers and dog walkers because they're traveling 35 miles an hour and they aren't paying attention.
Mm-hmm.
That needs to be regulated. What really needs to be regulated is the introduction of things like e-bikes that occur unregulated and then proliferate. Instead, we need to have entrepreneurs prove to us that these things are not going to be damaging to our society, our culture, our young and old people alike.
Now, when you say the entrepreneurs prove to us, who is the us? Who are you wanting them to kind of answer to in that innovation of new products and services?
It's got to be governmental. If you look at AI, it's already the
Mm-hmm.
horse is out of the barn. And we know that AI is currently being used by some firms as a way to provide coaching, counseling to lonely teenagers that are suffering from self-doubt and
Mm-hmm.
poor self-esteem. And those lonely teenagers are getting very bad advice, ultimately leading to suicide. And now we have the courts stepping in and parents suing AI providers. And this comes back to Section 230, where software should have a conscience, should be regulated, just the way television has been regulated for
Sure.
70 years. And yet they're not being regulated because of Section 230. So that to me is where government needs to play a more meaningful role in helping our country withstand what is going to be a 10% abuse of the AI models that are out there. And that 10% is going to have grave implications for millions of people in the United States.
Yeah. And without running the risk of getting too political, which we don't do on the podcast, but we'll run that risk here. The argument would be, and we see this in sports, bringing it back to athletics and health and that kind of stuff. We see it with medical boards. We see it with sports and NCAA to the government getting involved in the NFL to all sorts of stuff, right? But there's a discussion of bringing the government into a broad spectrum thing like AI and letting them start to do that. We saw this when the internet came out, right? How involved is the government going to get in what websites exist and how people can do it? When do we start to trim the capitalist society's ability to pursue the dollar and to throw it back into the market and for the market to self-perpetuate? And when do we allow government to kind of say, yeah, you can make money, but make it money within these parameters?
Yeah. That's a really good Gordian knot that you've laid out there. And if you think about it, crypto was one of those things that was not going to be mainstreamed because the legislators and members of Congress were not going to allow that to happen. And then they flipped that switch, and now all these crooks who are hiding their money, their ill-gotten gains, are using crypto to hide it, and we have no way of holding them accountable. The same is true of sports gambling. When we had Atlantic City and Las Vegas, I think the country was fine. It wasn't suffering from a lack of access to gambling. But now we have it on, the ads are on TV through all the sports events. You're wearing the ads on your uniforms. They're sponsoring bowl games and tournaments, and all that is leading to young men that are becoming destitute because they were given $100 by a gambling company, and they lost it in 30 seconds, and then they went into debt. It's kind of like the debt that hospitals, I'll bring it back to healthcare.
Yeah.
So I show up at the hospital, they have to take me. I have a gunshot wound in my shoulder, and I have no insurance. They have to take me, and so they offer me a loan to pay for the health care that I'm about to receive to fix my wound in my shoulder. That loan becomes egregious. I can't pay it. It starts to accumulate interest, and now it gets really big. And I'm now in hock for $30,000, $40,000, $50,000 because of all the interest payments on that modest amount of loan that I took out for hospital care. And who's the sublender here? It's the hospital. And then the hospital hires loan sharks to go after people like me for not paying back my loan. And it's just a horrible situation that was created by hospitals getting into the submarket of loan sharking and lending.
Well, we could go down the road of socialized healthcare and everything else, but we won't go there. I don't think that's something. Certainly, we won't do that in the next handful of minutes.
I will say one thing, and that I am a Bernie fan of Medicare for All, because I think what has happened is by letting shareholders into the profits that healthcare companies are accruing, You've now taken Medicare trust fund dollars that we all contribute as we go through our lives and get employed and contribute to the Medicare trust fund. All 20% of that money is now going to for-profit companies to reward shareholders for betting on United Healthcare or Humana. And that's, I think there's a better use for that 20% than $1 trillion going into those firms' pockets. 90% of United's EBITDA comes from government programs, which are funded by taxpayers.
Right. Yeah, it's again, we won't go too far down that rabbit hole, but it's a good statement and certainly one that people should be thinking about or considering.
Yeah.
So let's get back to the business for you. And do you, first of all, Healthragious, do you have employees? Have you grown it to the point of where you've got several employees, or is it still in the infant stages?
We have 16 employees.
Okay. So talk to me about
very capital efficient. We've recorded more than 26 million in revenue off of 2.8 million of investment. So that's an ROI that is almost obscene, 10 to 1, and it's what makes a lot of people make their mouth water, that we're that capital efficient. We're capital efficient because we don't believe in large workforces. We rely on technology to perform the manual labor jobs that are not worth investing in with personnel. So if you look at McDonald's, they have a 300% churn in their workforce every year. And that means you have this army of HR executives that are working on advertising, recruiting, testing, training, making sure there's no fraud coming into your workforce. And then ultimately, after you get them all trained and working efficiently and effectively, they go to another job and say, thanks very much. So that's the kind of healthcare workforce that hospitals are dependent on. And hospitals take down one of every $3 in the healthcare system, which is greater than $4 trillion a year. So if you have hospitals being 1/3 of that $4 trillion, that's a lot of money that's being spent on the janitors, the people who are swabbing the halls, the people who are at the front desk helping, training, the candy stripers, just an army of entry-level employees that are not adding value to the ultimate system, but are required in order to run a business of that kind. We have none of those. Our average employee makes $78,000, and they're delivering more than $500,000 in revenue. Each employee delivers more than $500,000 in revenue.
Nice. So talk to me then. Obviously, the cash necessarily isn't the issue. So talk to me about what some of those obstacles are that you're running into in your business right now.
There's, for every visionary, innovator, creative, there's only 10% or less of the target market that are going to resonate with your idea. Mm-hmm. And finding that 10% is really challenging, particularly when you're starved for capital and you can't afford these big marketing campaigns that sprinkle the United States like bird shit, coming down. That's just that's what the big boys do. That's what entrepreneurs can't afford to do. And finding that 10% that are really going to like your idea is really difficult.
Gotcha. And so that's a consistent pursuit for you.
Yeah.
Gotcha.
A good
So,
example is the state of Minnesota. So you may have heard the expression Minnesota nice,
yeah,
where they smile and they nod and then they go about their business pretending like they never even heard you or met you. And Minnesota nice is keeping us from a major opportunity of improving Medicare and Medicaid in the state of Minnesota, because there are these employees that are set in their ways and incapable of appreciating the value of something different than what they're accustomed to.
gotcha. So there's an education component for the market, not just for your consumers, but for the delivery personnel in the market as well.
No, I think that, this is, if you go back to Clayton Christensen at the Harvard Business School, he talked about the adoption curve. And the
Mhm.
adoption curve, we're at that beginning where the first 10% on the slope up,
Yep.
they have to get it without education. It just has to be there. They have to implicitly understand what you're saying and what you're conveying and what you're choosing to do for them. Then, when those 10% adopt, then it takes off like gangbusters and everybody wants it.
Right.
So that's the Tesla challenge, and that's the SpaceX challenge. And Moore's Law kicks in here because
Hmm.
as soon as these ideas become valuable business pursuits, the cost of the inputs starts to drop dramatically because you're creating many more inputs, and so the unit cost drops. And so we now have satellites circling the globe for SpaceX, thousands of them. And there used to be one or two of them, and now there are thousands. And the one or two cost an arm and a leg. The thousands are now 90% less costly than the original ones and much more effective.
Yeah, and I think um, the interesting component for you is once you've got those early adopters, how much momentum can you get without having those marketing dollars?
Yeah.
So talk to me about the investors, and I know we've only got a handful of minutes left, but talk to me about that investor process, because it's one thing to get early adopters in the market. It's a completely different discussion to get early adopters from investors. So how easy was that for you to get people on board?
So I'll give you a good example, Russ. In 1988, I got recruited to join on the ground floor at Value Health.
Hmm.
And we had a specially managed care idea that we would do specially managed care like I had done in psychiatric for foot care, for radiology, things like that. And we raised 28 million on a napkin
Hmm.
with no revenue, and the 28 million was to be deployed in acquiring really attractive companies that could do what we wanted to do. We made the 4 or 5 acquisitions, and in 3.5 years, we did a 1.5 billion IPO. I was head of sales and marketing. I got the 10% adoption curve, and then it took off. And to get to a 1.5 billion IPO in 3.5 years is extraordinary. I've never done it since, and I suspect I never will. But
Yeah.
that's how challenging it is to find those early adopters. But if you succeed, man, the sky's the limit.
Yeah. Well, this has been wonderful. So take me back to that Rick Lee that was touring the world. What's the one or two things you want to tell that young man about the journey that's ahead of him?
I think serendipity is a wonderful phenomenon that I've benefited from immensely.
Yeah.
So always be open to serendipity, because you never know when it's going to tap you on the shoulder. And I think, secondly, there's a lot to be said for the road less taken, and to consider going down that road and investigating and exploring and opening your eyes up to something that others may not have seen or understood.
A life lived in innovation. Rick, this has been a pleasure. I appreciate you joining us. Anything I haven't asked that you wanted to throw out to the audience?
Oh, I think it was a great interview. It was a lot of fun.
Good.
Thank you.
Appreciate you being on. So that's a wrap for this episode of Legacy Unscripted. If today's conversation sparked something in you, don't just let it sit. Take action today to build your future. Make sure to subscribe, leave us a review, and share this with someone who may need to hear it. And if you've got a story to share or you just want to connect, you know where to find me. Until next time, keep it real, keep it bold, and keep living your legacy.